are discussing the weather. That's right.
Strange, of course, but we're used to it here in Arkansas, always changing.
Always.
Yeah. You've been getting a lot of questions and emails about some of your procedures. And kind of some of them sort of have to do with the weather changing and what season is best to do some of these. Yeah, it's spring, and that gets everybody to thinking about looking better.
That's right.
Doesn't it? Okay, but first of all, we've got a question about laser resurfacing.
That's
right. Elaine from Jonesboro is interested in this, and we'll kind of have Dr. Branman explain exactly what it is. But Elaine says, I'm interested in having laser resurfacing. Should I wait till fall, though?
Depends.
Okay.
Laser resurfacing is where we take off the surface layer of the skin to refreshen it and give you a much smoother glow to your skin.
Right.
Now, if you're getting a mild one, you can really do that any time of year. If you're a sun worshiper, probably want to wait till the fall.
Okay.
And so it sort of depends on kind of your lifestyle, what you're going to be doing during the summertime, and then we can, you know, sort of pick and choose for that patient exactly when to do that.
Okay, because when you take off that outer layer of skin,
makes you sun sensitive.
Very sensitive to the sun.
It's kind of like getting a sunburn, and then afterwards you don't want to be in the sun after a sunburn.
Right, exactly. Is this the same as we hear microdermabrasion all the time?
A little bit different. Microdermabrasion you can do anytime, and that's very a superficial type of treatment. But the resurfacing really gets down and gets rid of those fine lines and wrinkles. Really kind of gets rid of those big pores and all that good stuff.
What's the downtime? Like, you wouldn't want anybody to see you for
3 days to 7 days, depending on how deep we go.
Okay, okay. So plan some time off to do that.
That's right.
Okay, good. Let's get to Kendra from Little Rock, because she emailed in a question. She's interested in breast augmentation, but also she's thinking about summer. She says, how soon can I get into the water to go swimming after having breast augmentation?
Well, we tell patients about 4 weeks. So you wouldn't lose your whole summer, and if you did it soon, you'd actually enjoy the entire summer.
Right.
Yeah, 4 weeks is about the time that we don't want people diving into water, getting submerged, taking baths, jumping in the lake, you know, things like that. Once 4 weeks has gone by, pretty much everything is really healed up well.
Good.
And you can do pretty much anything you want to do.
I know the incisions are so small these days. I mean, so you almost feel like you could do anything right away, but you need to
got to give it the time to heal up completely and really get that, I call it a sort of a watertight seal.
Right. Okay. So about 4 weeks to get that tight seal. I like that. Okay, we're going to talk about SmartLift procedure, and you can explain what that is.
Sure.
But Pam from Conway says, what is the downtime for the SmartLift procedure?
Well, the SmartLift procedure is actually where we tighten the neck as well as bring back the jowls to give women a very nice, and men, a very nice jawline. Gets rid of that sort of, we call that little turkey gobbler thing. And I think it's a great procedure for patients. The downtime is about 7 to 10 days.
Okay.
So really not bad either.
Yeah, not bad.
And really, I have a number of patients who actually within 3 or 4 days are out and about running around, and people really don't know because all the incisions are very well hidden in the hairline or under the chin.
Yeah.
So it's really not a long time before you're out and about.
A lot of people are fine with their face. It's their neck that they hate so much.
That's
maybe shows their age.
And this does a really nice lifting of the neck.
Good. And it seems like all of the recovery times are down from what they used to be.
They are down because we're taking greater care to really do a delicate surgical procedure, and the tissues heal up much quicker that way.
Okay, very good. Okay, we're going to ask a little bit about fillers today because we've talked a lot about those on the show. Very popular.
It is very popular.
And let's see, the question is from Karen here in Little Rock. What is the difference in Sculptra? Sculptra. I thought, there's supposed to be a C there, S-C-U-L-P-T-R-A, compared to other fillers available.
I love Sculptor, one of the newest fillers on the market. Great for filling in big areas. The other fillers, they fill in like fine lines and wrinkles, but the Sculptor really can fill in, let's say you've got a sunken in cheek or an area that you really want to build up. The Sculptor you can use for those areas, and it really fills them in and lasts up to 2 years. So it's really a great new filler that's on the market. And we're really seeing a lot of interest in that, and it's working really well.
So some of the others you've talked about on the show are still good for those fine lines, laugh lines, and all of that?
The Sculptor is really good for building up deeper tissues, and the other fillers are good for filling in the fine lines and wrinkles. And so that's the difference between the two.
Okay, so it kind of depends on what you're trying to achieve.
That's right.
I think we've got time for one more, so how about we do Becky from Cabot. Do you do surgical procedures in your office? Good question.
That's a very good question.
Does it happen right there in your office?
Some of them do and some of them don't. Some of the minor procedures we do in our office. Other procedures we'll take to a hospital type setting. And so we actually can do eyelids and facelift procedures, things like that in the office. Some minor liposuction, things like that I think work very well in the office setting, and people do very well in the office.
And then what would you then go to the hospital for?
Well, longer procedures where we're taking maybe 2-3 hours to do a procedure. Maybe we're doing a combination of a breast augmentation and liposuction, or a breast lift and a tummy tuck. And so those bigger procedures we tend to take to the hospital setting.
But a lot of the smaller ones, he can take care of you right there.
That's
which is nice. And you go home and rest and have some downtime and come out looking beautiful.
Yes, they do.
All right, let's put up the information, of course, about Cosmetic Surgery Center right there on Executive Center Drive, 227-0707 if you have any questions. And you can always just call them. We might share your question on the air like we've done today and get you some good answers from Dr. Branman. All good? I think we covered a lot of material.
I know we did.
We appreciate it.
It's good seeing you.
Take care. And we'll get some sunshine back too
I hope
for you
so soon.
Okay, we're going to take a break. We are